Okay. Hey Emily, I'd just like to thank you for taking the time to talk to me today about how you use communication in your workplace as a nurse.
Yeah, no worries.
Thank you. So at the moment, I'm just really curious about how you can use effective communication to build relationships, especially between co-workers and clients, or in your case, patients.
Yeah, so I communicate in different ways with work colleagues than I do with patients. With work colleagues, it's a different process of gaining the trust and having the same goal to give the patient the best care that we can, and communicating with doctors, allied health, other nurses, managers is the best way to do that. And with patients, it's building that instant rapport with them. First impressions are a big deal because
Definitely.
the second you walk in that room, they're already thinking, they're already anxious, they're already, who wants to be in hospital? So you have to make it a good environment where they trust you and they're going to open up to you, because that's how you're going to give them the best care.
Yeah, because if they don't open up to you, that could potentially create serious harms for their health.
Yeah, so if they don't trust you and feel like they can talk to you, they're not going to tell you if they're feeling sick. They don't want to be a bother, so they just stay silent and they don't bring up any more concerns or queries that they have.
That must be a real issue for you. Do you find that occurs quite a bit, or?
Yes, definitely, especially with the elderly. They don't want to be a bother, and whether that's they've been told that in the past, they say, "Oh, I don't want to be a bother." They won't call the nurse buzzer for us. But when I meet them and make that initial connection, I definitely show the importance of, if you need help, if you have concerns, queries, or anything, you give me a bell, because that's my job. I'm here to help you.
Definitely. So would you say that it was harder to build relationships with your patients, or would you say it was harder to build relationships with your co-workers?
Definitely patients, because every patient's different and they come in for all different reasons and all different times in their life, from being children to adults to the elderly, and you have to cater for all their needs. Culture, religion, and personality comes into that.
Yeah, it must be really difficult to learn how to cater for each individual, especially because you're quite new to the profession. So did you find that quite challenging at the start?
Definitely. I don't think anyone likes conflict, but at the beginning of my career, I did have difficulty responding to those. If a patient was angry or something didn't go right, and they would put that on me, and I didn't really know how to handle it. But even 12 months later, my communication skills have developed a lot compared to my first day.
Well, I suppose communication is something that's always evolving. Like, you will always be adding to your communication skill set, I suppose.
Yeah, definitely. So every patient is a learning opportunity, because there are different. Everybody's different. So
Yeah.
whether they're open and honest with you from day one, or if they walk into the hospital already having that barrier up, and you just chipping away at it, getting to know them, and not just in the clinical sense, but asking about their family and what they did before they retired, etc. It gets them talking, and it gets them to trust you.
That's a really good outlook to have. Have you ever had an experience where a patient has come to you already having that damage and not feeling comfortable to open up to you? Have you ever had that?
Yes, definitely. I have multiple times, because it takes one situation or one person to not communicate effectively or mistreat them, and it sticks with them for the rest of their lives. And especially in a hospital setting, they go in already anxious, going, what if I'm treated like that again?
Yeah.
If people are rude, or they don't communicate, or they feel completely out of the loop with their healthcare. So I'm definitely one of those people that I keep them in the loop, obviously not breaching confidentiality and out of my scope of practice, but
Definitely.
I definitely promote the patient-centered care, so they know and their family knows where they are in the situation.
How would you approach a situation where you had a patient who didn't want to talk to you, who didn't want to tell you if they felt sick or something,